Here are the people that need to get a measles vaccine. My name is Dr. Rubin. A lot of people have been asking about this because of the recent measles outbreak in West Texas and New Mexico, although there are actually 8 states in the country that have reported cases of measles. So it is a concern for a lot of people, and this is the list that people need to consider. Number 1 being children. There are 2 doses in the MMR vaccine series. The first is given at 12 to 15 months old. The other is at 4 to 6 years of age to be fully vaccinated and have about 97% protection against a measles virus infection, but there are other groups of individuals that should consider getting a measles vaccine. Anyone who's traveling internationally should be vaccinated against measles. This includes babies 6 to 11 months old. You can give them 1 dose of the MMR vaccine, and then you would resume their normal series after that and get 2 additional doses. In addition, healthcare workers should get vaccinated or make sure that they have evidence of presumptive immunity, as well as women of childbearing age. If you're planning on getting pregnant, you are going to need to make sure that you know that you are vaccinated against measles, because you can't get that vaccine while you are pregnant, and you want to make sure that you're protecting your developing baby from getting sick. This does leave several adults wondering if they should get an additional booster of the MMR vaccine, and this is my personal opinion on it. You look at the CDC guidelines, which hasn't changed over several years, and it talks about whether you have presumptive immunity against measles. So if you have documentation of 2 doses of the vaccine, you don't need an additional dose at this time. The current evidence suggests that even if the antibody titers go down over time, there are studies to suggest that your actual effectiveness against measles still remains very high for decades after getting vaccinated. Now, there's going to always be exceptions to this rule. As an example, if you're immune compromised, you should talk with your doctor to get more information about this. But if you don't have evidence of immunity because you don't have your vaccine records, you could get a blood test to measure antibody titers, and if those are low, you could get an additional dose. But people born before 1957 don't need to get vaccinated because it's presumed that you were likely infected with measles, since pretty much everybody was getting it prior to 1957. Now, there are several reasons why somebody is not able to get a measles vaccine. As an example, we talked about before, they could be pregnant, they could be immune compromised, so they're not able to safely get the vaccine, or they have a relative that lives with them that is very sick, so we want to make sure that they don't get sick in that small chance, or they may have had a history of an allergic reaction, which is very rare, to a previous dose of the vaccine. But this is why it's so important for at least 95% of the community to be vaccinated against measles in order to have something called herd immunity, to protect those that are unable to get vaccinated or may have that small chance of not mounting a proper immune response to get protected against measles virus, because this can be a life-threatening infection or could disable people. So please share this information widely so people can understand who should be vaccinated against measles and whether or not you may need a booster. Always talk with your doctor if you have a question about this.